Today I wanted to talk about a personality disorder that I haven't covered in any of my other videos, and that one is histrionic personality disorder. And so what I'm going to do is just go through the DSM definition and also the criteria that count towards a diagnosis like this. So in the dsm-IV, histrionic personality disorder is defined as a pervasive pattern of excessive emotionality and attention seeking, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following symptoms. So number 1 is they are uncomfortable in situations in which they are not the center of attention. So if there are situations that are not focused on this person, they usually feel uncomfortable or even quite irritable, angry, annoyed that they are not in the spotlight and want the spotlight to be back on them. Number 2 is interaction with others is often characterized by inappropriately sexually seductive or even provocative behavior. This might be just the way they interact with people is really inappropriate, overtly sexual, and this may have been a way that they have learned to get attention or to shift the attention back onto themselves. Number 3 is that they display rapidly shifting and shallow expression of emotions. So their emotions aren't really set throughout the day or for long periods of time. They kind of experience bursts of emotions, and often they're quite insincere. Number 4 is that they consistently use their physical appearance to draw attention to themselves. So this might mean sometimes in that sexually seductive category as well, like dressing very overtly sexually. Maybe they wear really interesting, weird, or different clothing. Not that by any means that someone has this disorder, but if they do, it may be a symptom of that as well, along with clusters of other types of behavior. Number 5, they have a style of speech that is excessively impressionistic and lacking in detail, so very vague in how they talk about things. Number 6, they show self-dramatization, theatricality, and exaggerated expression of emotion. So these are people who sometimes it seems like their whole life is like a reality TV show, or like they're acting for the camera, exaggerating, kind of using these false personas to make an impression on people or to make people feel a certain way about them. Number 7 is that they are suggestible. So they're easily influenced by other people or by circumstances. They don't often kind of have really fixed opinions of their own. They kind of go along with whatever might be occurring around them. And number 8 is that they consider relationships to be more intimate than they actually are. Some of the reason I think for this is that these are people who are very focused on themselves and attention being on them. So they may not actually connect with others on the same level that they feel they're connecting, because often the conversations they have are just about them, or they're focused just on them. People who have histrionic personality disorder quite often have a distorted mental opinion or view of themselves. They base self-esteem and self-approval on how other people feel about them. And they have a need to be noticed, which leads them to kind of having very dramatic or over-the-top behaviors. This is a disorder that affects more often women than men. And that could just be because men often report these symptoms less, or that the dramatization is more obvious in women. And this is not in some ways like some of the other personality disorders like borderline or antisocial personality, where these people do not always function so well in society. People with histrionic personality disorder quite often function well in society. They often have good jobs. The issue is that these symptoms are still occurring for them, and they use their disorder quite often to manipulate people to get what they want, or even to show a side of themselves to people who don't know them really well that helps further them in their career quite often. With HPD or histrionic personality disorder, the diagnosis and the reasons for this developing are vast and varied, and there may be a genetic component. There is some thought that also as a child, if traumatic behaviors were reinforced for these people, that they may learn that these behaviors are okay and as a way to get attention. So parents who don't discipline their children or who encourage those dramatic behaviors or pander to them actually can create a more likelihood that HPD will occur or be quite prominent in the life of their child as they grow up and get older. Obviously, for treatment-wise, as with a lot of the personality disorders, people quite often don't seek help because they don't think they have a problem or they don't think they need the help for their personality disorder. But psychotherapy is always a good choice for working through a personality disorder if you are someone who realizes what's going on for you and you really want to get better. You might have depression, anxiety that comes along with your diagnosis, and so maybe you need medication as well. And also, dialectical behavior therapy is always a great option for personality disorders, just learning about distress tolerance, learning about yourself, mindfulness, and self-awareness. So those are my tips for dealing with and looking at histrionic personality disorder. But like always, I always recommend that you see a doctor, a therapist, or even a psychiatrist to help you work through your own issues and symptoms that might be presenting due to this disorder. Thanks so much for watching, you guys. Don't forget to download my free guides for anxiety, depression, and also check out my social media where I post regular tips on mental health topics.